Aloha Kauai, here's our daily COVID-19 briefing from Team Kauai for Friday, June 19th. Happy Aloha Friday. As reported yesterday, Kauai confirmed its first new positive case in nearly 10 weeks. Our cumulative number of confirmed cases is now at 22. One person is in isolation and several contacts are in quarantine. I would like to invite our Kauai District Health Officer, Dr. Janet Berriman, to make a few comments about this new case.
Mahalo, Mayor. Today I want to talk to you about yesterday's confirmed case, which was reflected in today's statewide daily count. And after that, I'm going to talk a little bit about testing, so apologies in advance for being a little long-winded today. Our new case is currently at an isolation facility, and the family members have been relocated to a quarantine facility and are being tested today. There's no evidence that this individual traveled recently, so we're considering this a community-acquired case. However, our investigation and contact tracing are ongoing, and it's possible we will learn that this individual was in contact with someone who traveled recently. We will provide updates as details are confirmed. I know it's been a good run for Kauai as far as being COVID-19 free, but we were expecting this day to come. The nature of any respiratory virus is that it's easily transmitted through respiratory droplets whenever someone who's ill sneezes, coughs, sings, or even while having a conversation with someone in close quarters. COVID-19 is no different. The only difference is that this is a new virus, so we still have much to learn about its characteristics and, of course, the goal of finding antiviral medications and eventually a vaccine. The virus affects people in different ways, with some becoming seriously ill and others experiencing only mild symptoms. We can't predict who will be seriously affected. Although the incubation period averages 5 or 6 days, it can be up to 14 days. That means that an individual may be infected and yet not feel sick or display symptoms and still unknowingly infect other people. That's why keeping our germs to ourselves by wearing our masks and physical distancing from others who we do not live with is extremely important. In some homes, even inside the house, physical distancing and wearing masks in shared spaces may be a practice that a family would want to apply, especially if they're living with someone who has underlying health conditions or with individuals who are elderly. This additional case here on Kauai is no reason to be alarmed, but it is a good reason to be careful and to apply all of the best practices that we've been speaking about from the beginning of this pandemic. In addition to wearing masks and physical distancing, if you feel sick, you should stay home and contact your physician so you can be tested. Kauai is doing a lot more testing now than we were at the onset of the arrival of COVID-19 on Kauai. Patients who have concerns about COVID-19 are encouraged to call their doctor's office first for medical advice. If you do not have a primary care physician, please call 808-245-1504 to schedule a telephone visit with a respiratory clinic provider at Wilcox Medical Center. If you are ill with a fever or cough and think you have been exposed to COVID-19, contact your doctor to see if you need to be tested. Stay home and avoid contact with others, except for when you're seeking medical care. I want to talk a little bit about drive-up COVID-19 specimen collection sites. For added convenience, Wilcox, Kauai Medical, and KVMH continue to offer drive-up specimen collection for COVID-19. Patients will need a doctor's order for a test, along with a valid form of ID and an insurance card. Wilcox Medical Center's drive-up specimen collection is located at the rear entrance of the medical center. It is open from 8 to 5 on weekdays and 9 to 2 on weekends and holidays. The Kapa'a Medical Clinic also offers testing from 10 to 2 Monday through Friday. A normal copayment may apply since testing is handled by a private lab. The lab will handle billing directly with patients, including those who do not have insurance. KVMH, in partner with clinical laboratories, also offers drive-through testing. Please call their COVID-19 specimen collection call center at 808-720-8124 for more information. And next I wanted to talk about antibody testing. There's been a lot of talk about this. Antibody testing verifies whether an individual has been infected with COVID-19. The tests vary significantly in their accuracy. Fortunately, our established labs are conducting very accurate antibody testing. This type of testing is usually not covered by insurance, and the cost is roughly $43. A positive antibody test means that you were infected with COVID-19 at some time, but it does not guarantee that you are immune. The current medical evidence is still studying the immunity, so we don't know yet whether there is immunity or how long it might last. Anyone wanting to get an antibody test simply has to call their physician and ask them to order it. The individual would then schedule an appointment with clinical labs at Wilcox Hospital or at KVMH to get their blood drawn. The blood sample is sent to Oahu, and the results of the test are shared with the individual and with their physician. If for any reason your physician does not want to order you an antibody test, a doctor at Wilcox can order one for you. You may call Dr. Heidi Hilsland at 808-632-2811. So as you can see, good and accurate antibody testing is currently and has been available right here at home on Kauai. Thank you very much.
Thank you, Dr. Berriman. As a reminder, Kauai's tally of cases and other information on COVID-19 can be found on the Kauai Emergency Management Agency or KEMA site at www.kauai.gov/COVID-19. To view the total number of positive cases across the state, please visit hawaiicovid19.com. The daily count on this site is updated at noon every day. The county is launching a new emergency grant program to help low and moderate income Kauai residents with rent, mortgages, and utility costs. This program can provide payments of up to $1,500 per month for a maximum of 3 months to assist residents who have suffered a loss of income due to the COVID-19 pandemic. The program was developed by the County Housing Agency and the Office of the Mayor. The county is partnering with Family Life Center and Malamapono Health Services to implement it. There were statements made on social media yesterday that these funds have already been distributed are now gone. That is not accurate. Applications are being accepted and no money has yet been distributed. However, funds are limited, so those in need are urged to call soon. To apply for this program or for more information, call the Family Life Center at 212-0850 or Malamapono Health Services at 246-9577. Earlier this week, we announced that the county was launching a CARES Act grant program for nonprofits. We have made a few changes to our application process, including removing the requirement that nonprofits must have been audited in the last 3 years. We have also added a question and answer section to help applicants with frequently asked questions. Details on the changes to our CARES Act grant proposals can be viewed on kauaiforward.com/RFP. There is a very tight deadline for this program. Grant proposals must be received by 4:30 p.m. on June 24th. We have received a very high volume of inquiries, and any additional questions must be submitted by the end of business today at 4:30 p.m. Questions submitted after close of business today will not be answered prior to the application deadline. Please email any questions to grants@kauaiforward.com. Finally, today we'd like to announce that Governor David Ige has approved Mayor's Emergency Rule 13. Rule 13 increases indoor gatherings to 50 people and outdoor gatherings to up to 100 people. Given our new cases, we do have some hesitation in relaxing gathering rules. However, as we've said all along, we know we cannot stay home forever. We need to figure out a way to coexist with this virus. This requires each and every one of us to take responsibility for how we conduct ourselves to help protect those around us. If we continue to practice very simple behaviors in our daily lives, we can help mitigate the risk of our exposure. This means stay home as much as possible. Refrain from social gatherings or public outings. If you must interact with people outside of your home, maintain a distance of 6 feet of separation and wear a mask. Remember, my mask protects you and your mask protects me. It's a sign of respect and aloha. Do not leave home if you're sick unless you're seeking medical attention, and then only after calling your doctor first. Wash your hands frequently and clean surfaces often. Stay informed and connected during this time of social distancing. We'll continue to post updates on our official County of Kauai Facebook page or on our Kauai Emergency Management Agency page at www.kauai.gov/COVID-19. The Centers for Disease Control is also updating its website regularly. For more information, please visit coronavirus.gov. Not everyone has internet access or follows the news, so please help to keep your loved ones informed. Be kind, take care of one another. God bless, and aloha.